So let me now turn the program over to Dr. Fagbemi, who will introduce and tell us a little more about hepatocellular carcinoma and the first patient that we will be discussing.
Thank you, Dr. Hawking. Our first case is a patient with hepatocellular carcinoma. I will give a brief overview of this condition. It's an uncommon condition both in the United States of America as well as worldwide, but the incidence worldwide is actually much higher because of a number of factors. In the United States for the year 2008, the estimated number of cases, new cases, was 8,500, while worldwide about 50,000 new cases are supposed to be identified. It's a disease that is more common in males. There are some risk factors that have been identified as predisposing to the development of hepatocellular carcinoma. The identification of these risk factors actually helps in defining what kind of preventive strategies can be instituted, as well as screening to make sure that patients are seen at a stage where they can be better treated. These factors include an underlying liver dysfunction as a result of viral hepatitis, particularly hepatitis B and hepatitis C. Also, any form of chronic liver disease from alcoholism resulting in cirrhosis can also lead to development of hepatocellular carcinoma. A genetic condition called hemochromatosis is also one in which, once it's identified, prevention of liver disease as a result of this is useful in helping prevent hepatocellular carcinoma developing in those patients. In some parts of Africa, there are some toxins such as aflatoxins which have been identified as leading to the development of hepatocellular carcinoma. The diagnosis of any malignancy, and hepatocellular carcinoma is not an exception, is based on biopsy. But to decide on which patients need to be biopsied, a number of things will need to be done, such as an appropriate history, a well-done physical examination, as well as a directed set of laboratory studies. The studies of particular relevance to hepatocellular carcinoma is one that measures the level of haptofetoprotein, as well as levels of the baseline liver function of any patient. Of course, in directing such a biopsy, radiological studies are very helpful, including an ultrasound, a CT scan, sometimes an MRI or an MRA or angiography that defines the vascular structure of the liver that will be helpful in those patients that end up having such procedures as will be defined later today, as well as a PET CT scan to identify whether or not this patient has a widespread pattern of disease. The treatment options will be dependent on the stage of the patient at presentation, the nature of the patient's background liver function, as well as other health conditions in these patients that would affect the ability of the patient to tolerate treatment. For those patients who are found early and who have disease limited to the liver, the surgical option is preferred. For those that have regionally advanced disease, an option that is appropriate is the one that will be described by Dr. Gant later today. And for those in whom the disease is outside the liver, more widespread, we offer systemic therapy. In this instance, we recognize that these treatments are palliative in nature, but may afford patients longer life or relief of symptoms. The agents are not very efficacious, which affects the ability to use them, but they are sometimes helpful. A slew of agents include hormonal treatments such as tamoxifen or Megace, megestrol acetate. We have a variety of conventional cytotoxic agents, including doxorubicin or cisplatin or 5-fluorouracil, as well as more recently targeted agents such as sorafenib or bevacizumab. These agents are sometimes offered either solely or in various combinations for patients. Our patient this evening is a 55-year-old male whose past medical history is of hypertension, diabetes mellitus, coronary artery disease, and prostatic hypertrophy. It was an evaluation of his hypertension that resulted in the identification of his liver lesions. He had an MRI done, and the MRI showed multiple liver lesions. At the time, the rest of his examination was defined as unremarkable. A biopsy of one of the lesions was performed, and it was consistent with hepatocellular carcinoma. Because of the pattern of distribution of the masses in his liver, the patient was considered not a candidate for primary surgical intervention. However, because of the fact that the lesions were limited to the liver, a regional therapy was recommended to the patient.
Thank you very much, Dr. Fagbemi. Before we go on to talk more about this patient, let me just ask you to comment a little bit and maybe put in context what we mean by a rare cancer, since we're talking about rare cancers this evening, and how that might compare to some more common cancers like lung cancer or breast cancer.
Thank you. The hepatocellular carcinoma has a U.S. incidence of 8,500 estimated for 2008. Let us compare that to the commonest cancer in the country by incidence, which is lung cancer, where for that same year, the estimated incidence is 220,000 new cases. Or breast and prostate cancer, that will be responsible for 180 plus new cases a year, or colon cancer, 150,000 new cases. So by comparison, 8,500 is quite, yeah.
Yeah, and that points out some of the difficulty in doing studies to determine the optimum treatments when you really don't have a very large number of cases.